action.
Quite on set.
What camera do we look at? Oh, do we not look at the camera?
You
Do I need to
You don't look at the camera, just
Do I
talk.
look at
You
you?
don't have to like
Okay.
stare at me.
The cameras aren't there.
Just act as if there's no cameras here, we're just having a
Oh god!
conversation.
It's like we're in EastEnders.
Go. Right. So here's the Craic podcast. Our first guest, Catherine Bronagh, McClelland. Can't even say her name. Start off, Cathy. What is your role in the NHS?
So I'm a nurse, newly qualified. I just qualified in December.
Yeah.
So then I started working in February.
Yeah.
So I had like 8 weeks
Before
on a normal ward before
Yeah.
COVID hit.
And what about you, Bronagh?
So I'm a radiographer.
Yeah.
Started working in May, like a lot sooner than I was meant to. I was meant to just be graduated in July and then working after that, but I've been working like the past 3 months.
Yeah. So COVID had already like hit when you started working, so you were
Yeah,
you went
so
in
I'm
there.
like working on like the temporary COVID register.
Yeah. And you were working before it hit.
Yeah.
So like when was like the stage where you were sort of like, holy shit, like this is mad, like the whole COVID, like when was it, did everything sort of change then?
Well, we got like pre-warned that we were going to be moving to ICU. So I'm a surgical nurse.
Right.
So we were told we were going to become ICU nurses.
Right.
And when I was told, I like cried because like I feel like I still don't, but didn't know anything. So I thought I'm not going to be any use to anybody.
Yeah, it was scary.
Yeah, but it was quite good in that everyone was in the same boat. Like nurses who have been qualified for like 20 years
Yeah.
felt that same way. So
Yeah.
that was quite nice.
And what was like the first day going in when it all changed? What was that like? Was there like a certain day where you went in and everything was different, or?
Yeah. So like we were brought to ICU and literally it was so surreal. Like everyone was just lined up. Like I said to you,
Yeah.
I said before, like it was like literally jumping over the wall to go to no man's land.
Yeah.
Like I didn't know what I was walking into.
Yeah.
Everyone had their PPE on. It was like going into space. It was
Yeah.
crazy.
And did you find it was easier for you, Bronagh, because you sort of knew what you were getting into, or was it sort of the same?
Yeah, I feel like for you had like a few weeks of like normality where you were like working on the wards and then it changed. But then I feel like for me, it was really like easier for me to adapt because like it was just what I was starting into. Like there was no change. It was like straight away you're going in and like wearing all like the PPE and everything, and like all the big donning stations and stuff. I think like the first day was overwhelming, but then like you just got so used to it.
And did it take long to get used to wearing the PPE? Like how hard was that?
No, like after a few days, like, you just get used to it. But like the first day, it was like, oh my god, and like all these nurses are like standing around like watching you,
Yeah.
and like you're so afraid to like do like something wrong. Like you need to like hand sanitize and put your mask on, and hand sanitize and put your visor on,
Yeah.
and like everyone's like watching. It's also like, oh my god, what if I do something wrong? But like.
Yeah.
Now you're doing it every day, you don't pass no marks, it's just like your routine. Just like normal, and just get used
So
to
I
it.
thought the wearing all the gear was like the hardest thing. Like the patience and that, like I got used to it and I got to like really enjoy it.
Yeah.
But I could do that all the time, but not in all the gear. Like my nose, like, my face was wrecked. Like
With like pictures of Cathy,
Yeah.
she like blister on her
blisters
nose
on my
and
nose and
everything.
all. It was,
So you found it harder then? Yeah.
And like while you're in there, like everything starts to like, the more obviously you're sweating, like you're working and you're sweating, everything then starts to shift, and it was claustrophobic. It was that was a lot. I thought it was hard.
Do you find it like annoying now when you see people like giving out about having to wear masks in public,
Yeah.
and you're
and
like,
stuff, yeah.
Yeah.
But even mum was like, oh god, like, I have to wear a mask, and we were like, you wear them all day,
Yeah.
like 12, 13 hour shifts.
Yeah.
Are you joking? You can wear it for 20 minutes in the shop.
people
Yeah.
complain. I seen how it was like people are complaining about having to wear them because of Face ID in your phone. It doesn't like pick your face up.
It is annoying though in work, it is annoying.
That's mad. And do you find like with like patients and stuff things change much? Like with like like the way you would have dealt with a patient? Like was there much different than what it would have been like before?
Patients. Yeah.
But like obviously did you like what way do you don't really have to keep your distance around I suppose, like if you're wearing protective stuff and all? But like, did anything like change? Like, was it any different? You know.
Well, yeah, because I the reason why I never wanted to be an ICU nurse is because ICU patients are majority under sedation, like you can't speak to them, and I like a good crack.
Yeah.
So I'm like, I like to like chat to people. So then, obviously, like they weren't able to speak, so that was massively different.
You missed the crack one.
Yeah.
What about you with radiographer? You know, was it any different? Like,
not really. I think you can just tell that the patients are so much more nervous coming in, and like they can't hear you as well, and like you can tell that they're nervous. I don't know. It's not that different. I think with our like day-to-day job, the only thing that is different is the PPE and just like more like thorough cleaning and stuff in between patients. But we should be doing thorough cleaning anyway. Like we should be wiping down our equipment and all anyway.
I think that's what a lot of the jobs, even like we were saying, or like Shay and Ross, like in like work, because there's a lot more cleaning. Like Shay works in the bookies, so he says like you're cleaning like how many times, like 6 or 7 times a day now.
At least 6, yeah.
So
what all PPE wear do you wear? Like? Is it masks?
So now we're just surgical masks, like just because we've gone back to normal now. But before it was like everything, like scrubs, sexy Crocs, and then like a full on.
Yeah. But like,
they're like big surgical apron things.
Surgical.
They're really,
so like
really
if you go in, like say like you're going in to start the day, like how does it go? Like what way does it go? Like putting the stuff on, like if you want to go like bit by bit, like.
See PPE, there's like red PPE, which is like what Kathy's on about, like the big fitted masks.
Yeah.
You've hairnet, a visor, the big aprons, and then do you put like a little apron as well,
top.
And then your big long gloves.
We have long gloves. We had long
like,
and another
ones.
pair of gloves.
So like every day I would just be in amber PPE, which is just like the wee masks and a visor.
Yeah.
And then if you're doing a patient or examining a patient, it would just be a little apron and like a little pair of gloves.
Yeah.
Then like I would be in like red PPE for like theatre or like portable like chest X-rays and stuff in like ICU.
Yeah.
So like I think that's when I realised how hard that would have been for Kathy in the red PPE for hours, because like we would have went and done one portable which would have been like 20 minutes in that gear, and I would have come out absolutely sweating and like so claustrophobic and couldn't wait to get it off. So I'm like, how did she feel going in like 2 hours at a time?
I think people don't really like, it's not as if you just putting all that gear on and just standing there like chilling. You're actually doing the like working your ass off for the length of time, so you are sweating. Like coming out having to actually change your scrubs because they look a different shade of blue.
I went on a portable. We had 4 ICU portables to do. Right. It took like an hour, maybe under an hour. And I came out and the like other radiographer I was with had to go change their scrubs because like they were sweating, like you could see it was just soaked through. I wasn't too bad, thank God. But like it's horrible. I don't know how you did it. And like that was just for an hour. That wasn't even like you were doing 2 hours at a time, and that was all day. What we doing like 2 hours in, 2 hours out.
And then you go on your break and you have to take it all off and put it all back on again. Do you think it like it's added time on to doing everything as well then? Like obviously like everything takes so much longer. Like.
Yeah. And like I remember at the start it being like literally the first one I was like you just think overthinking, you're like like because there's like obviously everyone's fitted to different masks. Yeah. So I was like panicking like I don't even know what mask I am. But like I did. But you just like panic and then you am I doing everything right? Like you never wanted to be donning or doffing on your own, like we never did, but because you were like make it like you had always someone there to be like, oh you need cause it can it becomes your routine, like then you check each other before you go in. Like
I think taking it off is more important, obviously. Like what would you take off and you're not touching?
And is it sort of like easing off, or is it the same? Do you still have to wear the same amount of stuff now? Like, or is
not us now because we've gone back to being a surgical ward.
Right.
But might happen again.
Yeah, hopefully.
Watch this space. Tune in next week.
Exclusive. Oh wow.
Tune in next week.
You can definitely tell that it's like quieting down.
Yeah.
It's not as intense, and it's like slacked off. a
Like
bit,
leading
but-
up to that, obviously, like you've seen in the news and like the other countries, like coming, like, you know, everyone's sort of preparing for it. Like, was there a stage where you're like, shit, this is like proper gonna be mad? Like, was there ever a stage in work where you, before it all started, when you were like, this is serious, like were you
This
prepared?
is serious.
But you know what I mean?
Stuff.
Was there any point
Yeah.
where you were like prepared, like, you know, where you sort of like, right, this is gonna hit, like?
I was just so scared.
Yeah, at the start I was so scared.
And then see, like, coming home, all you like in work, all you hearing is COVID, like all this whatever. Well, it's serious stuff.
Sick,
But
that's
then
not
coming
bad.
home and then the news being on
Yeah.
constantly, and it's
Yeah.
like I just want a little minute to not be thinking about it.
There was
Yeah.
no getting away from it, like.
No.
Like, at least with the likes of us, like, we were just at home and then you just see the news,
Yeah.
we were in the middle of it. I think you were saying last night, you were like saying about how it's like, it's not like you were just like off for like the whole
Yeah.
point, you were working
Yeah.
through it. And then like the whole clap for the NHS thing, like what did you make of that? Like, what did you like you were saying, like you were in work during it, it's not really
Yeah. So
Yeah.
I don't think I ever actually seen the clap other than Facebook,
yeah.
Yeah.
like videos, because I was in work till 8:30. Like I didn't see it.
But even like where he's live, like he's live right,
Yeah,
like
the
I live
country.
in.
I think Mum went out and
I
packed one
did.
time.
No, I did see it one time. Mum went out the back door.
Yeah.
There was a guy up the road played the bugle. You know the thing that they do, like at the World War II and all them ceremonies. There was a guy up my road. Literally, I live in the asshole of nowhere, and
Yeah.
I just walked out the door and I went. I was like, what the hell's going on? That's for the NHS. Do you find though that yous are more like recognised? Like, it's. I think it's tough going from like where yous are, because like yous are both. You've been there for a lot. You've been there longer, but like do you notice like? Because I see all this stuff about like letting people, like NHS workers like in the queue first, which I do think is fair enough. Like, do you notice that you are kind of like more recognised, or do you just think that that's kind of something that I feel like the news tries to bullshit it a lot?
I did until the whole pay rise thing came in.
Yeah.
Yeah, like, yeah. What did you make of that? Like the whole pay raise thing.
I just think it's a shame.
I was
It's
saying to one of
annoying.
my mates, I was saying like this would have been the perfect opportunity for like the government just to be like, we're giving you a pay raise,
Yeah.
and like because it's like Boris Johnson had it, like, and like you think out of all people, he like it's alright coming out and saying, oh, like thanks to everyone and the whole clap to the NHS, but like nothing's really been done from it, like,
No,
Yeah.
and like
because you said before about how we did get a rise.
it was like last year or
A
something.
raise. I keep saying rise. That wasn't a raise. That was just basically getting what the rest of
England is good.
the
So like in
UK
Northern
gets.
Ireland last year, it was like you just got equal to what they're getting in England.
Yeah.
Yeah.
That's a joke, like.
Yeah.
But even like you were saying, like you have to pay for parking, like, and you had to pay for parking. Like, that's ridiculous, like.
Not now,
Not now, but
but
like,
no,
things like that, like.
that's finishing though. We do have to start paying at the end of the month.
But like you think that, like, even without all of this, like NHS staff shouldn't have to pay for parking if they're working in a hospital. Like, I was so shocked that I couldn't believe it when you said it. I was sort of like, you serious? Like?
Mm.
And it's expensive too.
Like even as a student, like going to work,
Yeah,
you weren't getting paid to be there, and you
Yeah.
still were expected to pay for the parking.
yeah.
I feel so sorry for students at the minute. Like I've seen
Mhm.
like students walking in and out, and then like nursing
Mhm.
uniforms, like the like all the university ones and
Yeah.
stuff. Like, they're getting nothing
But
for being
you-
there.
You were like, you were a student, like you were on your last placement when it all
when
started.
it started, and we
Um,
got pulled off placement. Like,
But like,
really
you weren't
early.
pulled off straight away. Like, you were sort of like
Yeah.
saying to me, like you were like, well, like I don't really know when, like, am I gonna be
Yeah.
finishing it out or?
Because like this all really started like St Patrick's Day is what I think of
Yeah.
the news. So then I think we did placement up to like the very last week of March, and then we were pulled off, and then yeah, they started like doing this temporary register. So I had to do like my dissertation, I had to do my like exam online,
Yeah.
and then so I signed up for like the temporary register just to get working like
Yeah.
soon. Yeah, I remember like that last week of placement, like we were all terrified, like all the PPE was coming in and stuff.
Yeah.
But then that kind of like prepared me then for like when I did start working,
Yeah,
sort of knew what
you were
to
sort of
expect
eased
in a
in,
way.
whereas like
yeah.
Kathy, you were sort of like, you didn't really know what to expect. Like.
Yeah, and I think that like so if there is another surge, I think it's good in that we will like know what to expect.
Yeah.
But then I think people, well, I'll speak for myself, I'll not speak for the people.
Yeah.
It's so disheartening. Like, I won't have the same, like, yay, like, for it, because it's like, you can talk all the talk, but you still don't respect us enough to give us a decent wage.
Definitely.
What
So
would
I think it's just disheartening.
yeah. What would you be happy with? You know, like what, like I don't. But do you know what I mean? Like if the government was to come out like next week and get
I
like
just
say,
think, I like, just look at it fairly. Look, it's not fair.
yeah,
Look, this isn't going to be a debate about the pay, is it?
No,
Let's
no.
move off that topic.
that's okay.
But it is. It's not that we're just looking money. It's like I'm only coming out into it, and for me, like the money is like, whoa. It's not like I've been working for years and not getting any more money, and I'm fed up. It's like I'm only starting. So for me, like the money's great, but it's just like we have been working through this whole thing. Everyone else has been sitting at home on their asses making banana bread and still getting paid. Do you know what I mean?
That's what we were saying last night. Is like I was like saying it's not like there's ones in work can be like, oh, like.
You liked that.
I don't think
I love that.
I don't feel comfortable.
That look of adoration, like, yeah, you go, girl.
But like it's not
We
like
didn't get the chance to make banana bread once between the
no,
two of us.
it's not like you can be like, oh, I don't really feel comfortable with this. I don't want to do this. Whereas like ones in like
But
offices
as well,
and
like,
stuff.
let's take it back to like, we've learned so much from it. Like,
It's been great.
at the start, I remember everyone saying like, you'll be such a better nurse for doing it.
Yeah.
At the time, I was like, I don't want to be a better nurse. I just want to be a nurse.
Yeah.
But now, like, I know I have learned so much and I have gained a lot from it. I don't know if I could mentally go through it again, but I have gained loads from it.
How tough was it like mentally? Like was there like days where you're just like, I just don't want to go into that?
I started off, I was doing yoga and meditating, but that wore off.
Yeah.
Because I was like,
That's odd, like. But like it's more like actions speak louder than words. Like it's like it's alright every minute. Yeah, we love the NHS, but like nothing's actually.
I feel like
done about it.
the clap at the start had like good intentions. Like actions do speak louder than words. So I feel like they were trying to do something, and like the kids doing like rainbows and stuff like that was lovely. Like Joseph did a rainbow and all, and it was lovely. But you can't just do that every week and like, what is it actually doing? Like,
did you see the thing and it was like my pay slip this month and it's like claps like on the thing.
Like it doesn't really mean anything in a way.
It's great. Like I'm not like slating it. Like it was really nice, but it's like.
Do you find like people have been like different, like when they hear that you're working for the NHS, they're sort of like, oh my god, like thanks so much, or do you think it's just sort of the same? Like, do you think even with like patients and stuff, they're any different with this?
At the start, you always had patients being like, "You said doing great and thanks so much," and it was like funny, like it was like nice. It was like like they obviously do like appreciate and stuff, but then. I don't know, then you still get patients coming in and complaining about waiting times in A&E and just giving off and being horrible, and you're just like, you're probably the same person that's written on Facebook appreciating us and clapping outside, but you're going to come in and be horrible. Yeah, I don't know. I didn't notice at the time because my patients weren't aware of what was going on.
Right, nice.
But it has like, since like I have seen like videos and stuff and like of patients that we had, and like that's lovely. Like that. That's why I'm a surgical nurse. I like to see the problem, fix it, and then wave them off. Like, yay, we did a good job. Whereas, and I did get that in a sense with this because when they, recovered and we got them, and then they went to the ward, and that was them like on their recovery. Like that was good. Don't know what point I was making.
But do you think like with people actually getting it then, like, do you think people realise the like severity of it? Because like you were saying last night, it doesn't really matter.
Yeah,
what if you have like if you're a smoker or what age you are.
I don't think it matters. I think and I think that's half the problem. Like no one knows. It don't matter who you are, whatever. It will just affect you how it wants to. It's not. There's no like trend.
Yeah, because like it was like people coming out in the news and stuff saying like, oh, it's like people who are over 60 and people who are smokers are getting it worse. But you're saying like you don't really think that there is a relation to it. It's just sort of like some people can get it worse or like. Just it's like I've seen like all ages. Like
all different people who didn't have any other health problems, people who've never had medication in their lives. Like, it don't matter who you are.
Yeah,
It's gonna get ya.
It's gonna
Get that out as well. For fuck's sake. Why do I always make everything into a joke?
Do you think?
It's not funny.
It's not. It's not a joke. Do you think people are taking it seriously enough? Like.
No, but you can't really blame people now. Everyone's sick of it.
Yeah.
I'm sick of it.
But do you think
so
you're probably
people want
more
it to
sick
get
of it
back to
because you've
normal.
been working on it?
Yeah, like people moaning about being at home, making their banana bread. It's
Yeah.
like, come on!
There's gonna be that one person who's been making banana bread all the quarantine. Listen to this, like, why me?
Why are you picking on me?
Dumps in the bin.
Yeah, no.
One thing I've always wanted to ask is, if you were in charge for a day, like so many people complain about like how Boris Johnson's went about the whole thing, and like how not Boris Johnson, like how the whole thing's been like fannied around, basically like go outside but don't go outside, like wear a mask but don't wear a mask, like that pisses me off. But at the same time, what I would love to know is from someone who like worked in it and like probably understands it a hell of a lot better, like if someone gave you power for the day to like control everybody in the country, what would you do? Like,
I wish I had been aware of this question before, because I would have prepped.
I remember talking to a doctor that worked in A&E, and like he was saying this is like when masks weren't like patients weren't told to wear masks coming into hospital, and like there wasn't like the whole like wearing masks in shops. But he was saying everyone should be wearing a mask, because he was like, okay, yeah, we're all wearing masks and visors and everything, but he was like him as a doctor, he's like, if I wear a mask and my patient wears a mask, that's two barriers between us, that's keeping us like twice as safe. Like he's like, I don't understand why patients aren't, and he said that weeks ago, so I think he's because now that's coming in.
That's what I used to say to people, because I was like, when you were sort of allowed to see each other again, and like me and you were seeing each other, like people would have been a bit like, are you not a bit worried because like she's working in a hospital and all? But I was like, she's probably more safer than anyone here's been, because like she's got all the PPE on and like wearing all the protection, where someone's going into a shop with nothing on. Like,
Yeah.
You know
That's
what I mean?
kind of how I felt, because obviously I was like, oh, I'll just stay away from home, like our mum and dad. But they were like, you were probably like in the state, although you're like knee deep in it or whatever. Like you're probably the safest, because like I've got all the gear on. I'm not like with people who are query it, or like you waiting on results. Like I was with the people that definitely had it.
Yeah.
These were the most protected.
So back to your question.
She likes this question.
Yeah, but I feel like I need to think about it. I think they should have. I don't know. I feel like a dick saying. Sorry, I'm allowed to swear.
You're allowed to swear.
Just in case it didn't actually pull up on the audio.
Well, Ross has basically said, if you were to be in power for a day, let's say, like, what would you have done?
Like
what
back
would
at the
you do
beginning, I would
different?
have taken
It's a good question. honestly.
like
action quicker.
yeah, like learn from all the other countries.
Yeah.
Like it was a bit delayed on it, and then maybe this is too political.
No, go on, say it.
But there's like such a confusion, I think, even now, between like, oh, is that us or is that England?
Oh yeah.
Are we Ireland? Where are we?
Yeah.
Like, even I actually just said, oh, we have to wear masks now anytime we go into a shop. And I'm like, or is that England? Like, who are we?
Yeah.
I was having this debate with my dad. He's like, oh yeah, my uncle said like you have to wear a mask for Monday, and I was like, no, but that's only England, and then he's like, no, it's not. But like it's sort of like,
I just think clear.
Should have been
Things
clear.
weren't clear, and
Yeah.
that should have just literally been nipped. Even like looking at Boris's, like literally what you said, like go outside but don't go outside, like literally that is exactly how it was. It's like that who actually understood what you should or shouldn't been doing.
just make things a bit clearer. But I think that's the thing, even like with Northern Ireland and Ireland, there was sure like Ireland shut down, and then Northern Ireland was like waiting on Boris Johnson. And it's like realistically we're the same country, like you know, it's not like there's this big fucking wall around the Northern Ireland.
That's I would have that's why I
bit
would
of a ball.
just like took note from other countries and been like, oh, like this is serious stuff. Everybody locked down.
It's like World War.
No, like, I agree. Like, I think the whole thing was just like, as someone who was like a member of the public, like wasn't working all that crap. Like I remember just like you were just kind of sit down here and I'll listen to what this guy has to say, and you came away from it being so frustrated because I would have far rather at the start he'd have just sat down and said, look, there's a virus. If you get it, you probably will die from it. So stay inside. Don't go outside. If your friends ask you to go out, you should say no. Like, that's it. That's it. Shit there. But instead, like, I don't know. Like it seemed to be like for the first 3 weeks, it was like proper like lockdown, happy days. Then after that, it just seemed like flipping.
I think as well, he was probably like afraid of like what's the phrase, like scaremongering. But that should have.
That's what he should have done.
That's what he should have done.
Yeah.
I think it's like the pressure of the public definitely got on them. Because I remember even like in work, like the Stephen Nolan show had always been on, and like every day he was like, "Are the government doing the right thing?" And he's all these callers on, and he's speaking to like the politicians in Northern Ireland and saying like, "Why is this like what's the case? It's like when are we going to be allowed to go outside?" It's just constant, and you're just sort of like, oh, "Fucking give over that."
Yeah.
I feel like it properly showed how well off we have it. Like the amount of crap I saw from people, and it was just like, I don't know. Coming from my end, that I kind of like understood it. I was like, right, we're not going outside. Like and you didn't see Bronagh, like I didn't see Lucinda, and it's kind of like I understood it. I was like, right, we're not. But there's so many people where I just feel like it really showed how privileged everybody is in terms of people were like, you were being told to do something, everybody was like, no, I don't think I'm going to do that. And it's like that was the point where someone should have said like put a bit of fear in people. Do you know what I mean? Like you don't get this, and that agitates me about the whole clapping scenario, because it's like you go outside and you clap, but at the same time, if you're told to wear a face mask, you'll be the same person who says, wear a face mask, I don't believe in them.
Was there anything that like frustrated you, like during lockdown when you were obviously working on it and you seen people just not following the rules, and you're like, I'm working in this one, and you are just not fucking doing anything?
Yeah, like obviously seeing like people still meeting and stuff was like.
Yeah.
Well, I think we covered a lot.
Yeah.
So like to round up.
Yeah.
I feel like I should be the presenter.
Oh,
I feel like you have been.
Is there anything you want to
This
add?
is a Kathy show.
Is there anything you want to add to the end?
I just think it would be nice to get like more recognition, like for everyone. I feel like they just talk about doctors and nurses, and like no nothing to you, because like nurses have been so great, and I don't even feel like they're getting enough recognition. Like the fact that doctors are getting a pay rise now, but they were due one anyway, weren't they?
It was agreed before.
So I think that's
Doctors.
really nonsense. Don't
Oh.
Breathe in. No,
they do a great job, but I feel like, come on, you're getting enough money.
Yeah, they do. Like, I don't know what to get paid.
But there's so many more people in the hospital. It's not even like, I don't mean to be like, oh, radiographers aren't recognised. They aren't, but neither are like physios. Like
hold on,
healthcare
domestics,
assistants.
cleaners.
Yeah,
they probably took the biggest
porters,
hit.
like there's so many people in the hospital. It's not just doctors and nurses.
I think, like,
and that's what's really annoying.
When you graduated or like sort of started working, that's one of the things like you and your friends got annoyed about. It was always like nurses, and you were like, I'm working here as well. Like there isn't just, no offense, but like there isn't just
but
nurses
like
in the
Kathy
hospital.
knows it. It took so long for nurses to even get recognised.
Exactly.
So like, at least they are getting some recognition, but still not enough.
So
I just think, stay indoors.
stay in, stay safe. Go outdoors, but don't go outdoors.
Yeah.
See your friends, but don't see your friends.
Yeah.
I think that was good. Thanks for doing it.
Thanks for doing it.
Yeah, covered a lot. More recognition for radiographers.
Yes.
Forget about
Also, the
commercials.
NHS is the best. Woo!
Positive vibes, yeah.
I should have put my wee rainbow
Course,
badge on
that's
that too.
it.
I'm gonna give you one.
That is the Craic.
But you didn't
Here's
get
the
them for
Craic.
free.
Oh, we're still recording.
That's it. Go on.
So did you not have to like conclude there?
No.
Oh,
He's
geez,
doing
not.
that.
But you can conclude if you want.
From Cullen, then you can. Just
In
go
conclusion,
down.
Well, I thought that
You have
was
to thank us for like.
I
taking
said
part.
thanks for
You did
coming
say
Did
on.
ya? Oh, I didn't hear
Thanks
it.
for coming on, Kathy and Bronagh. It's
Oh,
been a
you're
pleasure.
Welcome.
Thanks for having us.
Hope you enjoyed it.
See you again sometime.
See you soon, hun.